Hi, thank you for joining us today. My name is Dr. Jacqueline Sutera. I'm a podiatrist here at Pascack Valley Medical Group, and today we're going to be talking about the pandemic, COVID-19, and what it's done to our feet. We're going to be taking some questions, so if there's anybody who has something specific, please go ahead and ask your questions.
What are COVID toes?
Okay, so a question that I get a lot are what are COVID toes? And so COVID toes, right now, what we know about this condition is that some people, and it's really not very widespread, some people are getting blisters and a type of rash that form on the feet. It's really important to know that the COVID symptoms really are fever and all the ones that you see on the list a lot. So fever, loss of taste, cough, upper respiratory symptoms. So not a lot of people get COVID toes, but if you do, you should see your podiatrist.
What are common foot problems?
Great. So another really great question. What are common foot problems? And this happens whether, this is a question that I get whether we're talking about the pandemic or just in general, but the most common condition I see in my practice is plantar fasciitis by far. Plantar fasciitis is an inflammation of the ligament or fascia type tissue on the bottom of the foot. It's connected to the heel bone, and the most common symptom that you get is first step pain in the morning. So getting up out of bed or after periods of rest, when you step down, you get this sharp shooting pain. So some things that you can do for this problem is to stretch your calf, massage your arch, ice your foot, and avoid being barefoot. Also make sure that your shoes are in really good shape. So anything that's old, thin, flat, or worn out can also cause plantar fasciitis. So that's a common problem. Achilles tendonitis is a really common problem that's also connected and related to plantar fasciitis because the Achilles tendon is also attached to the back of the heel. So these are some things that happen regardless of whether we're home or not. But I'm actually seeing this a lot more right now because we have been on lockdown and in quarantine and people are working from home more. So I would say that these two problems are some of the most common problems that we've seen lately because of us being out of our routine and just being at home and barefoot and due to the pandemic, absolutely.
Are there any common foot problems specific to older adults?
So in older adults, in addition to the fasciitis and Achilles tendonitis that I talked about, something that's a little bit more specific to them might be some circulation issues, or if the patients are diabetic or if they have thin skin. So anyone who falls into that category, you have to be super careful about little infections that can turn into big problems. So especially with people that have diabetes or poor circulation, even an ingrown toenail can turn into a limb or life-threatening infection. I know that sounds really dramatic, but it's true. So something small can turn from localized infection and go up the leg, and then you end up in the hospital fighting for your foot. But really, you want to make sure that elderly people are wearing cushioned shoes because the fat pad on the bottom of their foot gets thin and also becomes what we call atrophied. So when that fat pad becomes thin and the joints might be a little arthritic, there's a lot of aches and pains that are common and very specific to elderly people. So for my elderly patients, what I recommend is that you check your feet daily, make sure that there aren't any signs of infection. See your podiatrist immediately if you see anything that's unusual or that hurts or might have an odor or a different discoloration. So check your feet daily and protect your feet. Make sure that you're wearing shoes that are accommodating and cushioned and also in good shape. So nothing old, thin, flat, worn out. You'll hear me say this over and over. And I also recommend that we wear slippers at home most of the time. This way you don't step on anything, you don't get splinters, and you're not continually and constantly pounding down on that fat pad that we talked about.
What do your feet tell you about your health?
So the question was, what do your feet tell you about your health? And they can tell you a lot. So you can have conditions that show up in your feet from psoriasis, for example. So psoriasis can affect your skin and it can affect your nails. People with thyroid or diabetes, also can have skin and nail manifestations. If you have circulation issues such as congestive heart failure or any type of varicose veins, sometimes you'll have swelling or certain types of vasculitis that happens in your feet as well. So it can affect multi-systems. But the most common, I would say, is your like orthopedic and your spine, just your skeleton in general. So the feet are the foundation of the body, and when you take care of your feet, that really translates well and all the way up to your knees, your hips, your back. So make sure that you're always supporting your feet. Foot support is super important for your whole body.
One question we received is, where is the fat pad on your foot?
Good question. So fat pad, there's two actually. One is on the ball of your foot, so underneath the metatarsal heads, and that's just behind the toes, and the other one is on the bottom of your heel. So you'll know that those are the fat pads because the skin is also a lot thicker there than anywhere else. So that thick skin and that fat pad underneath the bottom, those two fat pads there, you only get one chance at it. And as you get older and through wear and tear and time, that fat pad gets thinner, 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 and it cannot be replaced. So we do need to protect that, and that's why as you get older and as people get older in the aging process, you'll find that cushioning becomes much more important, and in your 40s, 50s plus, you're not really able to walk around comfortably so much without shoes, sometimes even at home. This is why that happens. So super important to protect that fat pad. And that's also the reason why a lot of elderly patients have to wear orthopedic shoes when they get older. So we want to prevent that, and we need to start making good choices in your 20s and 30s and even younger to protect that as we age. Thanks, Shannon.
What are good shoes to wear in the house?
Oh, yeah. So, I talk about shoe wardrobe a lot, and what that means is we're not wearing the same shoe every day. You want to have a few different types of shoes, and we all have our go-tos. That's fine, but make sure that you have a supportive type slipper. And what I mean by that, something that's not flat, old, thin. A lot of slippers are just like fuzzy and warm, but they actually should have some structure to them. So if they're a little bit thicker and have like an arch support, that's better than just like a thin, flat slipper. So you want to have a slipper, you want to have a sneaker for walking or for being active. Then you can also have like a fashion sneaker, which means, a sneaker that kind of just, you wouldn't really wear for exercise, but maybe just a casual look. And then your boots and your flats and dress shoes. So it's important to have a shoe wardrobe. But all of those shoes, the three things to look for in a good shoe, coming from a podiatrist, would be shock absorption, cushioning, and arch support. When you have those three things in a shoe, it's a better shoe. So stay away from anything thin and flat. And also, I urge you, go to your closet and throw away anything that's like old and worn out. I talk about a tabletop test, and what that means, you put the shoe on the tabletop, look at it at eye level, and if your shoe is tilted or there's like a hole or they're uneven, it's really time to replace the shoes, and you should actually get into the habit of replacing them before that even happens.
What foot exercises should we be doing aside from walking?
So walking is not really a foot exercise, it's a body exercise, but you should be doing some stretches. So when you do a lot of workouts or even just casual walking throughout the day, the tendons in your legs, let's just talk lower extremity, tighten, and you need to reverse some of that because the Achilles tendon, let's just take for example, is very prone to tightness, soreness, and can even shorten over time. So a really important exercise to do is a calf stretch, and I recommend it to, people with plantar fasciitis and Achilles tendonitis, but I think everyone should do this. Downward dog yoga pose is a really great way to do this. It's a full body stretch. You can also do it sitting down with your leg extended, your knee locked, and flexing your foot back. So that gives you a nice stretch in your Achilles and also in your calf. There's plenty of other ways to do it as well. You can do it against the wall like a runner's stretch or on a staircase. So you would just put the ball of your foot and then kind of flex your heel down. So those are easy ways to stretch your calf, and these should be this should be something that you do often to reverse some of the tightness and the soreness that happens. other exercises, I'll just go through it quickly. For feet especially, so feet have these small little muscles behind the base of your toes called intrinsic muscles, which are ankle stabilizers. And ankle stabilization is super important so that you don't fall, lose your balance. A way to make those stronger is to do toe grip exercises. So you actually want to use your toes and pick up an object, hold, and release. So that's one way to exercise your feet. Another way is to use your thumb, or actually your big toe, and you want to air draw the letters of the alphabet. So what I'm doing is A, B, C, D, E. So I'm not moving my hip, I'm only just doing it at my ankle. And when you do that, it exercises all 4 of those big muscle groups in your leg. And I would say that those are easy exercises to do. So exercises and stretching, super important. Also massage. Massage your calf and massage your arch, followed by ice, especially if you're having some symptoms.
One question is, can you repeat what to look for in a shoe again?
Yes, let's do that again. Okay. So avoid thin, flat, and then replace old and worn out, but look for shock absorption, okay, cushioning, and arch support. So it should have a little bit of a bump in the middle, or you can put an arch support in. And as a podiatrist, we make custom molded orthotics for some people that have very specific individualized problems, or one foot that's different than the other. So we make custom inserts that can be put into shoes. So avoid shoes that are completely flat, that you should have something that has a little bit of an arch, also that has some cushioning, and shock absorption is something that I talk about a lot too. You want your shoe to absorb the shock from your body weight and gravity that pushes down, and from ground reactive force that pushes back up. So I'm taking you back to high school physics with that, but it's just a quick a quick visual to kind of just really make you appreciate what your feet go through with every step. So the question was, do I recommend specific shoes for diabetics that are experiencing foot problems? Well, you know, there are brands that are specific for patients with diabetes, but there's also custom molded shoes that you may be eligible for depending on your insurance. So talk to your podiatrist, because sometimes we can actually make you a shoe that is molded for your foot, or that molds to your foot, especially for diabetes. I'm sorry, for patients with diabetes. But on the most part, you really, if you just want to buy a shoe at the store or online, look for brands that don't have too many seams. So actually the seams from a lot of the designs in the shoes can cause blistering and can cause infections over time. So that's really important. So look for a shoe that doesn't have any type of seam, that's smooth and soft on the inside. Also make sure that it accommodates the size of your foot. So many people come in with pointy or very narrow, stiff shoes, and they have like a bunion, or they have hammer toes. So if you have a foot condition, your shoe should accommodate your foot type or your foot condition. So make sure that it matches and your toes and your foot has enough room. So it should fit well, and it shouldn't be tight, stiff, or narrow. Make sure that it's smooth and it doesn't have any seams. So those are some over the counter or just, you know, off the shelf. But you might be eligible for diabetic shoes if you check with your podiatrist and your insurance company.
I have been walking around barefoot in my home, and I've noticed as it's gotten colder, I have had foot pain. Could this be related? Could the cold be related to the foot pain?
So the cold actually exacerbates and makes it a lot worse. The question was, a person on Facebook Live asked a question about walking around barefoot, and it's been cold and their pain has increased, right? So is the cold related to their foot pain? Yes, because your muscles kind of constrict and your vascular arteries and veins also kind of constrict. Everything just gets a little bit tighter when you're cold. Warmth loosens and opens things up a little bit. I recommend that you walk around with some cozy socks and some slippers. It's too cold, and walking barefoot all day, every day, especially if you're home a lot more, is not a good idea. It's causing a lot of increased foot pain in my patients that I'm seeing in the past year. Okay, so that wraps up our session here, Facebook Live. Once again, I am Dr. Jacqueline Sutera, a podiatrist here at Pascack Valley Medical Group, and my contact information will be provided at the end. Thank you so much.